First of all, welcome everyone and thank you so much for your time. It was a pleasure meeting you all. And आज हम इसीलिए मिल रहे हैं कि लोगों के दिमाग में मेंटल हेल्थ को लेके जो कंफ्यूजन्स है वो हम क्लियर कर सकें। मेंटल हेल्थ के बारे में बात करते ही लोगों के दिमाग में वो चीजें आती है बस कि या तो पागल है या फिर वो अपनी सेंस में नहीं है, दैट्स व्हाई वो काउंसलर, साइकियाट्रिस्ट, साइकोलॉजिस्ट के पास जा रहा है। ये बेसिक नॉलेज है, इसके अलावा लोगों के पास और कोई नॉलेज है नहीं व्हेन इट कम्स टू मेंटल हेल्थ। स्ट्रेस, डिप्रेशन, एंजाइटी, पैनिक अटैक्स की जैसा कोई कॉन्सेप्ट उनके दिमाग में है ही नहीं, अगर हम कॉमन मैन के बारे में बात करें तो माइंड्रो मंच से आज यहाँ आप जिस सब एक्सपर्ट से मिलने का और आपसे बात करने का, आपसे क्वेश्चन आंसर करने का हमारा मोटो ही यही था कि हम लोगों को इन बेसिक इंफॉर्मेशन से रूबरू कराएं, जो उनके दिमाग में ये कॉन्सेप्ट क्लियर करें, और वो जब अपने इन सिचुएशंस में हो, अपने आप के लिए भी और अपने अपनों के लिए भी, ये स्टेप लेने से घबराए नहीं या किसी एक्सपर्ट से मिलने के लिए नहीं घबराए। ये मंच उनके लिए ही हम लोगों ने रेडी किया है कि जब उनको कोई ऐसी सिचुएशन में वो है या उनके कोई अपने हैं तो बिना डरे सामने आए, अपने इश्यूज के बारे में बात करे। और माइंड्रो आप जैसे एक्सपर्ट्स प्रोवाइड कर ही रहा है, आप जैसे लोगों के साथ काम कर रहा है, तो वो उस चीज का बेनिफिट ले। सबसे पहले मैं आप सबका इंट्रोडक्शन हमारी ऑडियंस से करा देती हूँ। फर्स्ट ऑफ ऑल आई वुड लाइक टू वेलकम मिसेस सिमी हंसपाल. She's a happiness coach and she's working since, if I'm not wrong, since 2011, right, ma'am?
Yes.
Welcome to Myndro Munch, ma'am.
Thank you so much.
Great. Next, I would like to welcome Miss Sumbul Alladin. She's from Hyderabad and she's a counseling psychologist. She's, I think, practicing since 2010.
2008.
2008. Yes. Sorry, ma'am, for the click.
Thank you. That's it.
Yes. Thank you so much for your time and welcome to Myndro Munch.
Thank you. Thank you so much.
Next, I would like to welcome Diksha Goswami. She's a counselor and she's from Delhi. Diksha, thank you so much for your time and welcome to Myndro Munch.
Thank you. Thank you, Adam.
The person behind the entire idea, Mr. Pankaj Thakkar. He's the founder of Myndro. Thank you so much, sir.
Thank you, Anya ji.
Sir, so I would like to request Mr. Samraat Dave to handle this entire conversation and let us guide and the conversation between the expert and layman. Sir, please do the honor.
Thank you so much, Anya. Let me start by the beautiful lines by Nida Fazli ji, late Nida Fazli ji. कभी किसी को मुकम्मल जहां नहीं मिलता, कभी किसी को मुकम्मल जहां नहीं मिलता, कहीं जमीन तो कहीं आसमां नहीं मिलता, जिसे भी देखिए वो अपने आप में गुम है, जिसे भी देखिए वो अपने आप में गुम है, जुबां मिली है मगर हम जुबां नहीं मिलता. Yes, that is the actual problem of today's life, that we get so many people around us but we hardly find people whom we can really talk. तो ये बात जो बन नहीं रही है उसका कारण यही है कि बात नहीं कर रहे हैं. So today we are only going to talk about this particular subject called conversation, communication, because all our experts, आप सभी यहाँ पे मेरे साथ जो भी जुड़े हुए हैं experts, they come from the background of communication, कि जहाँ पे बात करने से कुछ बात बनती है. And Myndro is such a munch जहाँ पे हम यही establish करना चाहते हैं that conversation must happen. People should open up and people should talk about whatever they are feeling inside. So this particular episode is purely towards the enlightenment of all the laymen, जो लोग जानते नहीं है कि if they are suffering from mental illness or if they are suffering from stress or depression, then whom to go. Because there are many experts like psychologists भी है, psychiatrists भी है, happiness coach भी है, counselors भी है, लेकिन एक layman के नजरिए से ये differentiate करना उनको बहुत जरूरी है that which particular profession is helpful to them. So आज ये मंच के द्वारा हम यही establish करना चाहते हैं, हमारे experts के द्वारा यही establish करना चाहते हैं that we really enlighten the audience that each profession has that own nuances and how those nuances can really help a layman or a particular person who is feeling the pains of depression or stress. So I really thank all the panelists who have joined us, and I'll just throw a simple question to all the panelists one by one, if they can answer shortly, that how your profession means how your profession sets you apart from other profession which is in the same periphery. जैसे आप अगर साइकोलॉजिस्ट हो, आप अगर हैप्पीनेस कोच हो, then how your profession has different nuances from the other profession. तो मैं एक एक पैनलिस्ट से जानना चाहता हूँ, जस्ट एक लेमन को अगर आप एनलाइटन कर सके कि in your profession, what kind of experiences you are getting and what you provide, so that the people can really understand and come forward to talk with you, sir. So if we can just one by one, we can start with I think Sumbul आपसे शुरू करना चाहूंगा that
Sure, sure.
you
जी,
are a
जरूर. Thank you.
counseling psychologist. So
Yeah.
probably if you can just tell us the differentiation between your profession and the others.
Yeah, sure, sure. So the way I understand is that, say between me and Diksha is saying she's a counselor herself, right? So
Yeah.
between both of us, probably some of the course is overlapping, because I have a master's in psychology, I have a PhD as well, and probably Diksha also has undergrad or a master. So probably the course is sort of overlapping. And I think what is probably similar is that we are all from a helping profession. So we are committed to the growth of our clients, right? That's
True.
firstly the thing. And it's extremely gratifying work when you see your clients grow, when you see your clients do better. And also that safe space which we all create, whether it's a happiness coach, a counselor, or a psychologist, we
Yes.
all create that safe space where a client can talk about his thoughts, his emotions, right? And without being judged about anything that he or she is going through.
Yeah.
And also just a lot of empathy where he can open up, and in a confidential environment once again. So I think all these are the common points probably in our, as far as I understand, in all our professions. And it's goal driven once again. So, and the goals are made by the client. So they are whatever the client wants to work on. It could be relationship, it could be better self esteem. The client might see you for alleviating, for decreasing symptoms of depression or anxiety. So you do some symptomatic relief, you do some sort of growth, as in doing better as a person.
Yeah.
All that you do. Yeah. So I think for me personally, it's very humbling and very gratifying work, because a client lets you in their little world,
Yeah.
their
Yeah.
challenges, उनके डर, उनकी जो भी प्रॉब्लम्स हैं, उनके जो challenges हैं, fears हैं, they let you in that personal world of theirs, you know. So you form a very sort of it's a very personal and deep connection that you form with every
Excellent.
client, and that's a very humbling experience as well, right?
That
So
that is great to know, because entering into someone's personal space
yeah,
requires lot of trust,
yes,
because if the person is having the trust, then and then only you can enter the world of their own, and you can really help them. Diksha, as Sumul rightly said that more or less your profession resembles the things which she is also doing. So if you can just fine tune the differences or fine tune the nuances of your counseling part with what I think Sumbul is doing.
Okay, so basically, I am also a counseling psychologist, but I'm
Yeah.
also a school counselor. Okay,
Acha.
so yeah, so I specialize in the children and career guidance sessions with them. So I take career guidance session where I use the standardized testing tool. वो जो typical चला हुआ है ना कि okay science बहुत अच्छे marks है, then you should take science. Average है, then you should take commerce, and if below average, then take arts. So I and people in my profession, they break this stereotype, they break this this thinking pattern that only if you have this good marks then you can take science. No, we
Yeah.
deal it differently. We focus on the interest and ability of the child, of the person concerned, and if his ability and interest go in the same line, only then we suggest them or guide them to follow a particular career. Yeah. So this is how I work, and more or less our work is same. As ma'am
Yeah.
suggested, our work is almost the same. So
Yeah.
yeah, but because I specialize in school counseling more, and
Yeah.
yeah, I also take different session like relationship, and if people are dealing with work related stress, or they have some issue with parents. So yeah, these kind of cases I take. But we are different from psychiatrists and clinical psychologists in some ways. Like if you allow, then I can highlight the difference.
Sure. If you can
Okay.
just do it
Yeah.
quickly.
Yeah, okay. So psychiatrists are the MBBS doctors. So they are specialized in, they have a specialization in psychiatry, and they can make diagnosis. So they first assess the physical symptoms and the mental symptoms, and then they, diagnose. And if the client is going through some particular disorder, and then he or she makes the treatment plan and prescribe medicines. But we, as counseling psychologists or clinical psychologists, we cannot prescribe medicines. And being the counseling psychologist, we cannot diagnose the disorder, but clinical psychologists can. So this is the basic difference between us.
That is so humbling to know that you are working with particularly kids or the students who are going to the school, and you are counseling to them also. I just like to know from Dr. Sandeep that as just Diksha just mentioned few of the areas where clinical psychologist is getting different from a counselor or the counseling psychologist. If you can just throw some more light on exactly the kind of people you meet and the kind of people gets your help in clinical psychology subjects, sir?
Sir, due to some technical reason, he's disconnected. I am trying to getting him in.
Okay. Should we just go ahead with the other panels,
Yes.
right?
Yes.
Yeah. Okay, I'm coming to Simi. Simi, as right now there's a lots of void about happiness, because we all are feeling the stress of this COVID. Also, there are lots of other factors which are affecting our mind. We hardly forget that how to be happy or how to have the smiling face, because there are lots of tension, lots of depression going around. So in this worrying times, how a happiness coach is different from a counselor, or what different speciality a happiness coach comes with?
Okay, so Samraat, a happiness coach is not any different from a counselor. Okay,
Yeah.
so besides being a happiness coach, I'm also a mental health counselor, and but I am a trained counselor. Okay,
Right.
and Anya had informed you earlier that I am in this field for the last 10 years now, and. The reason I wanted to be a happiness coach is there is a proverb, a Chinese proverb, which really inspired me. And
Hmm.
if you allow me, I'm just going to
Sure.
share it
Sure.
with you. It says that if you want happiness for 1 hour, you take a nap.
Yeah.
If you want happiness for a day, you go fishing. If you want happiness for a year, inherit a fortune. And if you want happiness for a lifetime, help someone else.
Great. Great.
Okay. So my need to help, and all of us here, whether it's Sumbul or Diksha or Dr. Sandeep, all of us are here to help people. Even you on the business side, are there, you
Yeah.
started a business to help people, because the need of the hour is to understand that people are going through very distressing times.
Yeah.
So I, in my field as a mental health counselor as well as a happiness coach, I counsel people with emotional distress over the age of 16 years old. And the way I do it is I don't advise, because that is not my forte to advise, to give a plan to say that आप ये करो या आप ऐसे करो तो आपको खुशी मिलेगी. It is to explore to within you what are your resources of being happy. What is your definition of being happy? मेरे लिए happiness होगा to play with my dog. आपके लिए happiness होगा to go on a holiday with your family.
Absolutely. Yes. Yes.
Everyone's perception is different. So, to create that awareness, to empower them, to enable the clients who come to me to understand what my strengths are, what are my
Yeah.
resources, how can I be happy within, from within,
Yeah.
and
Yeah.
going to the core, going to the root cause of any problem, because ये जितने भी emotional issues होते हैं, ये
Right.
बहुत उनका एक root cause होता है. It's all coming from a central core,
जी.
gravitating from there. तो उसी को
Yeah.
identify करना, उसी तक ले जाना, exploration of the self कहते हैं हम उसको. And like Sumbul said, as and much what the client wants, अगर client को नहीं करना है तो ठीक है, we will do बीच तक आके अगर client कहता है कि अब मुझे और नहीं करना है तो which is fine. और अगर उसको पूरा जर्नी करना है तो वो भी ठीक है। और द कॉमन पॉइंट्स जो उन्होंने भी यही कहा था, सी वी आर ऑल वेरी हाई ऑन एम्पैथी, क्योंकि जब तक एम्पैथी नहीं होगी you will not be able to walk in the other person's shoes, right? And you will not be able to have that deep connected feeling with the person. And he will not open up, or he will not tell you what his deepest fears are, right? So maintaining confidentiality, having a good rapport, respect for the client, which is very high. And again, you know, not, and to empower them कि ठीक है अभी आपको आ गया है, अब आप बाद में क्या करोगे, क्योंकि अगर मैंने आपको एडवाइस किया तो कल को whenever you have an issue you will come back to me again. So that is not my aim, and that is not the objective of counseling, and that is very unethical, and it goes against the entire service of what we are doing.
Absolutely.
And for जैसे दीक्षा ने कहा कि जो मेजर मेंटल इलनेस के साथ आते हैं, so I am not qualified to diagnose or prescribe or do anything to them, तो फिर उनको फिर मैं रेफर करती हूँ to a psychiatrist.
Right. No, you mentioned a very valid point that it is all about the perception, because happiness cannot be defined in a general way, because everyone has their own ignition points where they feel happy. So your probably job is to let that person find the right happiness point for themselves, so that they can really trigger the moment ahead and they can really be happy from inside. So that is wonderful thing which you are doing. And again, as you rightly mentioned, the privacy part is very much important, because everybody is so much cozy about their own private things. So that is wonderful. I just come to Mr. Pankaj Thakkar with this Myndro's initiative. You are doing a wonderful job by providing a bridge between a customer or a person who is in need of any psychological help and the experts. There are lots of void जहाँ पे बहुत सी ऐसी जगह है जहाँ पे ये जो ब्रिज है ये बनना बहुत जरूरी है. In today's world, in today's global world, it is very important to do something online, because people are reluctant to go and meet any counselor or psychologist or psychiatrist, but on the world of online they can really get the help. तो मैं पंकज जी से यही पूछना चाहता हूँ that how you cultivated the whole idea, and how you really have so much of variety in your platform to have so many experts from different strata.
Yes, thank you, Samraat bhai. First of all, welcome all of you. And the main core theme of this our platform is privacy and all that we discussed earlier also. When I was thinking about to start this portal, I have found so many things which is not available, what I required, what I thought.
Yes.
So I shared all my ideas with my son Bansal, and after so many long brainstorming, we have decided to do something like that, which is not available in the market, which actually people need. Actually, what happened in the market, if as a layman, I can say, if I want to go to some psychiatrist or psychologist for my mental illness, but in India, I found there is a taboo. Nobody is happy to go with psychiatrist or psychologist like that. The family members or the friends and their all the relatives are saying that he is a police or he is ये तो पागल हो गया है. So that I thought कि हमें कुछ ऐसी चीज देना है कि जिसमें साइकियाट्रिस्ट भी है, साइकोलॉजिस्ट भी है, लेकिन उनको हम ऑनलाइन प्रोवाइड करें सर्विस. बिकॉज ऑफ समटाइम क्या होता है कि भी मैं आज कहीं ट्रैवल कर रहा हूँ, मुझे एंजाइटी हो रहा है, बट एट दैट टाइम मैं किससे बात करूंगा? ना तो मैं मेरी फैमिली को डिस्टर्ब कर सकता हूँ, ना मेरे फ्रेंड्स को डिस्टर्ब कर सकता हूँ. ऑल टुगेदर ऐसा है कि अगर मैं किसी को डिस्टर्ब करता भी हूँ, then they will guide me or advise me like what they people are thinking. So मैंने ये सोचा बंसल के साथ बात करके कि भाई कुछ जितने भी एक्सपर्ट्स है इंडिया के अंदर, इंडिया से बाहर, उन लोगों को एक प्लेटफॉर्म पे अपने लेके आए. अलॉन्ग विद दैट ये एक माइंड में है कि भाई इस टाइप का कोई प्लेटफॉर्म है या नहीं है. तो काफी हम लोगों ने एनालिसिस किया, उसके बाद जो हमें चाहिए था ऐसा कुछ नजर नहीं आ रहा था. और साथ में जो मेरी एक सोच ये थी कि भाई लोगों को होता क्या है कि मैं अगर कोई चीज के लिए आपसे गाइड कर रहा हूँ, मतलब आपसे मैं एडवाइस लेने आया हूँ, तो मुझे मन में ये रहता है कि मेरे कोई ये रिलेटिव्स नहीं जान ले, बिकॉज ऑफ द सेम थिंग व्हाट आई टोल्ड अर्लियर, यहाँ पे टेबू है। तो हमने साथ में ये भी रखा है कि भाई अगर मुझे कोई रीजन जान है कि भाई मुझे पर्टिकुलर कोई रीजन पता है कि भाई मेरे लड़के में ये चीज है, या मेरी फैमिली के लिए मुझे ये चीज चाहिए, या मुझे मेरे फैमिली से ये प्रॉब्लम है, तो मैं अगर everything is not possible to discuss with the psychiatrist and psychologist. Sometimes what happen कि मुझे खाली चाहिए क्या कि भी जो इस पर्टिकुलर सब्जेक्ट्स में जो एक्सपर्ट्स है उनसे मैं अपना ओपिनियन ले सकूं।
जी,
तो
जी।
उन लोगों को भी हम लोगों ने अपना रियल एक्सपर्ट जो भी है लाइफ के, उन लोगों को भी इस प्लेटफॉर्म पे हम लोगों ने लिया साथ में।
Great, great. So it is very great to know that Myndro is having all the experts in the kitty, and it is a wonderful platform where the patients can get the online help of all the experts. Now I'm coming back to Sumbul ji. Sumbul ji, what I really like to know as a layman, not as an as a person who is representing Myndro, but as a layman, what is generally the process if a mentally ill or a mentally disturbed person comes to you? Then probably what is the process of your treatment or your counseling sessions? How you go about it?
Okay. Yeah. So first of all, Mr. Dave, I'd like to clarify that not everybody can be put under the ill bracket.
Yeah, of course
right?
not. Of course.
See, many people are just facing day-to-day challenges of life, or
Absolutely.
just regular adversities which life has a way of bringing to our doorstep. Every now and then, right? It could be the loss of a loved one. It could be the loss of a job. It could be financial trouble. I mean, these are all just regular life challenges, right?
So yes, disturbances we can say. Some kind of disturbances. Yeah.
Right, some challenges. So not everybody can be put in that illness bracket. But of course, there are clients who come with signs of depression, anxiety, right? And also there'll be clients who will come with personality disorders or psychosis. And those are the ones who you will, where you'll pick out the signs, but you will not diagnose, but you will send them to probably a clinical psychologist as well as a psychiatrist for medication as well as counseling. Or some of us are trained, we have done some training with, say, OCD or with, say, borderline personality disorder. So we are comfortable to take those cases, in which case we take those cases as well. For example, I take borderline personality disorders. So that really depends on how comfortable you are, how much you're trained in, what kind of cases, right? And then as far as your question goes, that how do we take it forward? So I think the first session is like an intake session where you understand what is the client's world, right? And what is working, what is not working, what is he trying to avoid, which is creating more problems. What are his thoughts? Because thoughts create a lot of emotions which are not easy to handle sometimes. And with those emotions, how is he or she ending up acting? In the sense that what is his behavior? So it's thoughts, emotions, behavior. You keep making a note of all this. At the same time, you keep encouraging the client to talk, to be there, to listen, to empathize. At the same time, you quickly make notes, whether it's mental notes or actual notes, right? And then you take the slowly with as your rapport builds with the client, you make goals. You decide the goals, of course, are also you try to make some behavioral goals, not just goals as in they'll say things like, I want to feel better, right? But you probably get a little bit more specific. And so it's two things. One is that whatever distress he or she is feeling with depression, anxiety, or just a lot of thoughts and emotions. So one is that the symptoms reduce and they feel a lot better. They come back to you and they say, yes, I'm feeling much better. And the second part of it is that how are they functioning as an individual? How are they improving their life? How is their growth? How is their path of self-actualization? What do they finally want to accomplish in life? How far is all that going? So it's really a two-pronged approach. And that's how we go about it. Yeah.
Yeah, you wonderfully put it all the process in the words that what exactly goes through in the minds of any person who is little bit having some challenges, as you rightly mentioned. Not they are ill or not disturbed, but they are facing some challenges. So what probably is most required is to give them that listening experience, that they can just open up and share whatever they are feeling comfortably, and then probably you can have the processes of yours, and you can really treat them well. I come to Diksha. Diksha, as you have mentioned earlier that you're working a lot with the students, and right now students are facing so many problems because there is an online offline education is going haywire. So they are mentally confused that what exactly they need to do, and there's so many other resources on mobile or on laptop, so they might not be functioning or focusing properly on the education. So what is your take, and how you generalize your counseling sessions when you are dealing with the students?
Okay, yeah. Okay, so actually there is a, I'll call it a myth, or over generalization of the fact that the children are facing problem. Actually, they
Okay.
are learning a lot, because
Yeah.
we are moving away from the traditional way of teaching, and now we are using incorporating technology, and because of that we can incorporate videos or presentations. So they are gaining
Yeah.
skills, different skills,
Yeah.
which
Yeah.
they anyway anyhow they don't have exposure while they are in the offline class. The some
Hmm.
just hide out and sit at the back, but here they are getting proper attention.
Hmm.
So
Hmm.
they are learning something new. Yeah, there are
Yeah.
problem. There are, yes, there are problems. Why? Because socialization is the basic element of the school education,
Yeah.
where they get to socialize with different people, their seniors, their teachers, which are
Hmm.
they are not getting it at home, because they are
Hmm.
only sitting from 8 to 1 and attending their online lectures. They are not getting to meet their friends, they are not getting to meet their teachers. So this is the problem they are facing. But yeah, it is also, they are both good and bad of one thing, so they are more good than bad. But yes, during counseling sessions, yes, they reach out to us. They know who we are now. Because earlier when I was working with them, they just know, okay, there's a counselor in the school. But now, because I am there online and I am highlighted when I'm taking the session, so they come up to me. They are very open about taking counseling, and children are just the wet mud, and we can shape them any way we want to.
Yeah.
So they are so open about it. Like Pankaj sir has said that there's a taboo around, and this is
Yeah.
the new generation, and they are very open about taking counseling. They love speaking to the counselors and
Yeah.
sharing their issues. They're so honest. If they have issues with their home, in their home, they share with us. Sometimes
Hmm.
children say that to their parents that please go and take counseling because you need it.
Yeah.
So yeah, this is the trend that is going to change, not now, but in a decade or so. So yeah, this is how this thing in school is happening during COVID
Great,
time.
great. No, as Diksha rightly mentioned that actually they are also enjoying the processes of online education because they are getting the exposure, and they are also getting used to with the new technologies and new other things. But I'm so कि जहाँ पे खुश रहना भी एक हमारे लिए एक कला या जिसको बोलते हैं an art to learn हो गया है. वहां पे it is not necessary that if a person is feeling depressed or troubled or having some kind of challenge need a counselor or a happiness coach. मैं personally ये मानता हूँ कि now it is almost a need that even if we are happy, even if we are okay with our life, then also we need somebody कि जिसके पास हम ये काउंसलिंग एक कम्युनिकेशन की एक नई सोच पैदा कर सके. So probably being a happiness coach, how your process is little different from the say clinical psychologist or counselor psychologist.
Okay, so Samrat, see, what happens is that when a person comes to you,
Yeah.
like Sumbul said, cannot necessarily they are mentally ill. They may be
Yeah.
having some distress, some
Exactly.
emotional distress for
Yeah.
which they are coming, right?
Yeah.
So I am trained in Carl Rogers School of Thought, and according to Carl Rogers, he said that each person is well, and we are all capable of finding solutions to our problems. But it's
True.
only when we are in an emotional distressed situation our clarity of mind gets clouded. ओके तो उसमें क्या होता है कि जब वो क्लाउडेड हो जाता है तो उस वक्त हम थोड़ा लॉस्ट या स्टक फील कर लेते हैं. तो उस टाइम फिर हम, क्योंकि देखिए अगर मेरे को कुछ प्रॉब्लम है, मेरे घर में कोई इश्यू चल रहा है, इफ आई कम टू यू एंड से ओके कैन यू हेल्प मी, you wouldn't know how to help me better than how I know what my situation is, right?
Yeah.
तो काउंसलर का काम होता है, so for me it is basically first giving a very safe, a very confidential space to the person to come and share openly. और कभी कभी क्या होता है कि अगर मेरे पास बहुत यंग बच्चे आते हैं, 16-17 साल के एडोलेसेंट्स जब आते हैं, तो उनको लंबे सेशंस की जरूरत नहीं पड़ती है, बिकॉज घर में कोई बात करने के लिए नहीं है या कोई समझने के लिए नहीं है, या पेरेंट्स को जब कुछ बोलते हैं तो पेरेंट्स और एंग्शियस हो जाते हैं, तो दे जस्ट वांट टू कम एंड वेंट आउट. तो वो वेंटिलेशन जब मिलती है उससे भी दिल थोड़ा सा शांत हो जाता है. You know, like even in our personal space, when we talk to a friend or we talk to somebody who's close to us, who's not going to judge us or who's not going to pass any biases or doesn't have any biases, or को बोलेगा नहीं कि इसको क्या, she can't even handle her own problems or something like that. So, you know, so you always automatically start feeling better. Now, the difference between talking to a friend and a counselor or a coach is that, you know, there is objectivity involved. So the person, the counselor or the coach is trained to be objective, not bring in their personal biases, and just listen to what the client is saying, and then help and facilitate the client to come out कि अच्छा ठीक है, अगर ये नहीं हो रहा है तो अब आप क्या कर सकते हैं. And so like I said in the beginning कि मेरा काम है to take, because anxiety, depression या कोई भी जो issues होते हैं ना, वो secondary emotions होते हैं. They are all radiating from a primary root cause होता है. तो मेरा काम होता है कि वहां तक पहुंचना, क्योंकि जब आप वो चोट तक, वो जो एक्चुअल चोट है वहां तक जब आप पहुंच जाओगे, तो अब आपको पता है कि अब मुझे क्या करना है. क्योंकि जब तक हम ऊपर की परत को ठीक करते रहेंगे तो वो घाव जो अंदर तक गया, इट इज नेवर गोइंग टू हील, राइट? So my work is to be there with them, to walk at their pace. It's not my agenda कि मुझे अब यहाँ से यहाँ जाना है सेशन में. I'm going to walk with the client. In fact मेरी ट्रेनिंग तो कहती है walk 2 steps behind the client, ताकि क्लाइंट लेके जाए आपको जहाँ क्लाइंट को जाना है, राइट? क्योंकि क्लाइंट को रास्ता पता है, आप क्लाइंट के रास्ते पे जा रहे हो, क्लाइंट आपके रास्ते पे नहीं जा रहा है, right? So my way is to facilitate, to empower. तभी तो empowerment मिलेगी कि अच्छा ये मैंने खोजा इसको, I know how to take care of it. So that is what I do with my sessions. The first session is like a screening, जो सिंबल ने कहा कि intake है, तो screening है to find, try and understand. बहुत कभी-कभी ये भी जरूरी होता है कि प्रॉब्लम भी ना हो, you know, the person may not have an issue and still just wants to talk. और बहुत बार होता है कि बात करते करते वो समझता है अच्छा ये मैं तो ये कर ही रही हूँ, या मेरे साथ तो ये हुई, हाँ, आई एम एबल टू हैंडल इट, यू नो व्हाट, आई जस्ट वांटेड टू क्लियर माय माइंड, आई जस्ट वांटेड टू डू. वो बाहर जब हम वर्बलाइज कर लेते हैं तो समहाउ यू नो इट टेक्स फॉर्म एंड वी स्टार्ट एनालाइजिंग इन आवर हेड कि हाँ मुझे तो एक्चुअली इसका क्या करना है, आई नो हाउ टू हैंडल इट.
वेरी ट्रू, वेरी ट्रू. सिमी जी ने बहुत अच्छी बात करी कि एवरी टाइम इट इज नॉट अबाउट द प्रॉब्लम और एनी काइंड ऑफ ट्रबल्स वेयर a patient or a person who is coming to seek help really want that help. कई बार सिर्फ बात करनी होती है. मैं कई बार अपने सेशंस में बताता हूँ कि बात करने से ही बात बनेगी, बात करने से ही बात बनेगी, बात न करने से बातें बनेगी. So we need to just open up. So I just need to have the opinion of Mr. Pankaj Thakkar, since he is representing this beautiful concept of Myndro, कि जहाँ पे you are not only just providing the platform for the experts and the customers to gel well, यहाँ पे आप कई सारी ऐसी एक्टिविटीज भी करते हैं जहाँ पे आप लोग तक पहुंच सके, लोगों को अवेयर कर सके that okay, if these are the symptoms, then probably you need an expert or you need a person to communicate. So पंकज जी, इसके बारे में हमें थोड़ा बताइए कि सिर्फ ऑनलाइन प्लेटफॉर्म सिर्फ बना देने से बात खत्म नहीं होगी, उसकी अवेयरनेस भी बहुत ज्यादा जरूरी है. एंड माइंड्रो हमने देखा है कि लाइक दिस वेरी इनोवेटिव आइडिया, तो ऐसे बहुत से इनोवेटिव आइडिया पे हम अवेयरनेस का काम कर रहे हैं. सो व्हाट इज योर टेक ऑन दैट?
सम्राट भाई, इस जो आपने बताया है ना, उसमें मेन चीज ये है कि पीपल आर इन इंडिया, पीपल आर इज नॉट अवेयर अबाउट व्हाट दे आर फीलिंग.
हाँ,
लोगों को ये पता नहीं है कि भाई मुझे अभी क्या तकलीफ है
जी
एंड सो दैट होता क्या है कि भाई मुझे एक्चुअली कोई चीज का प्रॉब्लम है तो मैं कभी कभी तो हो सकता है किसी के साथ शेयर करता हूँ, कभी नहीं करता हूँ, तो अपने मन के अंदर ही मैं लेके उसको घूमता रहता हूँ।
या
एट द एंड ऑफ द डे व्हाट विल हैपन, या तो मेरी प्रोडक्टिविटी जीरो हो जाएगी, या मेरे फैमिली के साथ मेरे रिलेशन स्पॉइल होते रहेंगे, या फिर मेरे अंदर कोई चिड़चिड़ापन आ जाएगा, या फिर मुझे कोई एडिक्शन हो जाएगा,
जी
either it is a mobile addiction or something like tobacco और कुछ भी। तो ये सब चीज के लिए क्या है कि हमें एक अवेयरनेस क्रिएट करना जरूरी है कि भाई आप ये चीज कर रहे हो तो आपको एक्चुअली ये प्रॉब्लम है, सो गो टू समवन एक्सपर्ट, चाहे वो एक्सपर्ट आपका साइकोलॉजिस्ट है, साइकियाट्रिस्ट है, कोई कोच है। तो हम लोग अभी क्या कर रहे हैं कि माइंड्रो मंच के द्वारा हम लोग एक कैंपेन स्टार्ट किया है हम लोगों ने, कि जिसमें हम लोग एक पूरा अवेयरनेस क्रिएट कर रहे हैं कि जिसमें सभी अलग अलग फील्ड के लोगों को इसमें एक्सपर्ट और स्पेशलिस्ट को लेके आए हैं, कि जिसमें हम सब चीज को समझना चाहते हैं, लोगों को एक अवेयरनेस क्रिएट करना चाहते हैं। लाइक हमने एक आगे एक प्लान किया था कि जिसमें रियल लाइफ कोच, साइकियाट्रिस्ट, उनको लेकर के एक सुसाइड के ऊपर अपने एक बनाया था कि डोंट गो फॉर सुसाइड। उसके बाद हमने बच्चों के लिए काम किया, जिसमें हम लोगों ने अगेन सेम के चाइल्ड साइकियाट्रिस्ट और एजुकेशनल लोगों को उसमें लेके आए, सेलिब्रिटी को, कि भी आप लोग आओ और बच्चों में क्या तकलीफ नहीं होना चाहिए या क्या तकलीफ है तो नहीं डरे। उसके ऊपर एक हमने एपिसोड किया। अगेन हम लोग अभी एक स्पोर्ट्स अथॉरिटी के अंदर को किसी स्पेशलिस्ट को लेके आ रहे हैं। तो ऐसे बहुत सारी चीजों को हम लोग कंबाइन कर रहे हैं कि जिसमें अब ये हो सकता है कि भाई कोई फिल्म लाइन का हमने किया है तो भाई फिल्म में कोई आदमी गया है, कोई मेल फीमेल वॉट एवर दे आर, तो एक्चुअली फिल्म लाइन के अंदर क्या प्रॉब्लम है, वो जैसे ही एंटर होते हैं उनके दिमाग में कुछ और चीज होती है और जब वो फेस करते हैं तो कुछ और चीज निकलती है।
यस
तो एट दैट टाइम वो लोग क्या होते हैं कि वो लोग एक्सीडेंटली वो लोग क्या करते हैं कि भाई मेंटल इलनेस में वो लोग आ जाते हैं। तो ऐसे लोगों को हमने उस एपिसोड में इनवाइट किया कि जिसमें एक्चुअली फिल्म लाइन के अंदर क्या प्रॉब्लम है क्या नहीं है, वो सारी चीज को वो लोग वहां पर एक्सप्लोर कर सके और लोगों को समझा सके कि भाई जितना आप सोच रहे हो उतना अच्छा है या उतना खराब कुछ नहीं है। और द सेम थिंग हम लोग अभी जैसे एक अपना कैंपेन के साथ साथ में हम लोग अभी लोगों को सामने से प्रोएक्टिव होकर के जाते हैं, तो जिसमें हमने अभी गवर्नमेंट ऑफ गुजरात के पुलिस डिपार्टमेंट को हमने कंसर्न किया कि जहाँ पुलिस के अंदर भी इतना जबरदस्त डिप्रेशन है कि इट इज अ थैंकलेस जॉब जस्ट लाइक ए डॉक्टर।
या
तो वहां पर हम लोगों ने अपने आप वहां पर जाके उनको कमिश्नर साहब को आवेदन पत्र दिया और समझाया कि भाई आपके वहां पर जो प्रॉब्लम चल रहा है तो हम लोग कुछ करना चाहते हैं, और वो लोग भी बहुत खुश हो गए। ऐसे बहुत सारी चीजों को हम लोग अभी कंपाइल कर रहे हैं। एक कैंसर स्पेशल के ऊपर भी अपना एक प्रोग्राम अभी आने वाला है कि जिसमें कैंसर में अगर लोग पीड़ित है तो उन लोगों को भी एक्चुअली क्या वो लोग सफर कर रहे हैं उनको कुछ हम लोग अपनी ओर से कुछ अच्छा दे सके। राइट। तो ऐसे बहुत सारी चीज इनोवेटिव लेके हम लोग आ रहे हैं और उसको पूरे प्लेटफॉर्म के साथ साथ में मेंटल वेलनेस को अपने अवेयरनेस क्रिएट करने जा रहे हैं और वो कर रहे हैं हम लोग।
Great, great. Very true, Pankaj, because what we need to do is we don't need to wait for the people to turn up to the professionals. We really need to create that ambience and that environment where people feel inspired and motivated to come forward, and that is something which Myndro is doing so beautifully. On the last question, which I am throwing to all our experts or and the panelists simultaneously, you have worked tirelessly and you are representing this very humble profession where you are really working and you are really treating those people who really seek help, कि जहाँ पे आपकी एक कम्युनिकेशन एक बात भी अगर किसी की जिंदगी पूरी पॉजिटिव तरीके से बदल सकती है। वी ऑल आर लिविंग इन दिस वेरी ट्रबल टाइम्स। अभी कोविड के लिए वजह से बहुत सारे डिप्रेशन की केसेस भी बढ़ रहे हैं, बिकॉज पीपल आर फेसिंग फाइनेंशियल प्रॉब्लम्स, पीपल आर फेसिंग इमोशनल प्रॉब्लम्स, फैमिली रिलेशंस, सभी कुछ बहुत थोड़ा डिस्टर्ब हो चुका है। वन पर्टिकुलर पॉजिटिव मैसेज आई रियली वांट टू हैव फ्रॉम ऑल आवर पैनलिस्ट, कि जहाँ पे ये जो भी हमारा आज का माइंड्रो मंच देख रहे हैं तो उन सबको एक इंस्पायर और मोटिवेट कर सके, ऐसा एक कुछ कुछ ऐसी बात या कुछ ऐसा पॉजिटिव मंत्रा हमारे व्यूअर्स के लिए आप दे पाए। सुनमुल जी, आई लाइक टू स्टार्ट विद यू।
Okay, yeah. So, Mr. Davi, I come from this space, first of all, that I am not some sort of, some expert in whatever. That's my first thing, that, I want to be rooted in that. I'm also just another human being. And I make that clear to all my clients. So that's my first thing. But having said that, if you ask me for a few words of wisdom, which I can, I can say after interacting with lots of clients, and seeing their stories and seeing their struggles and my own life and my own challenges, right?
Yes.
So this is what I would say. I think the first thing I would say is that believe in your uniqueness, right? We each one of us, we are capable of a lot more than we give ourselves credit for. And put that self-critical voice down, close that self-critical voice, believe in yourself, believe in your uniqueness, and have the courage to take a few risks in life. I think for me, that's always paid off. Courage. That's one thing. And then the second thing I would say is that have a lot of kindness and let go of emotions like anger, resentment, hatred. They really bring you down. So if you can replace it with a lot of forgiveness and kindness and compassion towards all fellow beings, because everybody is going through their own share of issues, right? So if you can see it from that point of view and let go of that anger, that really helps. And the third and final point, I don't want to take up everybody's time. So the third and final point is meditate and practice mindfulness as much as possible. Be in the present moment. The past is over and the future is not yet here. We only have this moment. Make the best of this present moment. That would be my
those are the wonderful words and compassionate की जहाँ पे बात की मुझे दो लाइन फिर से याद आती है. Basically, I'm a man of poetry, so
that's wonderful. That's wonderful.
yes.
Yeah.
कुछ इस तरह से हमने जिंदगी को आसान कर दिया. कुछ इस तरह से हमने जिंदगी को आसान कर दिया. कुछ से माफी मांग ली और कुछ को माफ कर दिया. So that is something which we all need to believe in. Yes, Diksha, coming to you with the same question.
Okay, so she has beautifully covered most of the mantras, Sumbul ma'am. So this mantra is for people, who refrain from speaking up, and who have this thing of getting misjudged, and they don't seek out, for help. So for them, I want to say that कुछ तो लोग कहेंगे, लोगों का काम है कहना. Just reach out and talk about your issues with the, experts or people, psychologists or counselors, and because in the end, at the end, you are the one who is going to live with you, right? And we all have different issues, different problem. Many people say, okay, मैंने तो ये कर लिया था, तू क्यों नहीं कर पा रहा? So this is the common, statement that we all post. So like all sizes cannot fit the same shoe. वैसे ही we are also all unique and different in our own ways. So if someone else can, deal with the same problem which you cannot, just be it, just leave it. You stand up for yourself and reach out to us or any professional, mental health professional, and please work on yourself with them.
Great. So you just need to believe in yourself and whatever perceptions you are having, and just stick to it. Yes, Simi, you are a happiness coach, so some happy words from you.
Yeah, so Samraat, for me, I would say that it's time to talk about it. We need to normalize the term mental health, and we need to create awareness. We can start by teaching our children young, by telling them how important it is to take care of your mental health. We cannot, have any disparity between, give it equal importance as a physical ailment. जैसे फिजिकल एलिमेंट इंपॉर्टेंट है, उसी तरह फिजिकल हेल्थ इंपॉर्टेंट है, वैसे ही मेंटल हेल्थ भी इंपॉर्टेंट है. Until we keep looking at them separately, we will never ever, we will shy away from it, because हमें बहुत hesitation होता है, हमें शर्म आती है, हमें taboos होते हैं, and there's a lot of stigma attached to the word. And last piece, what I really believe in is that respect and kindness, not just to the clients, but to yourself first. I need to have that respect and kindness to myself first, and then only I will be able to, give it to others as well.
Great. You put it in very nice words that actually what is the need of the hour. And apart from पंकज जी से मैं आपको रूबरू यही क्वेश्चन से करवाऊं, उससे पहले एक बहुत अच्छा इनिशिएटिव जैसे सिमी जी ने बताया उसी पे हम ले रहे हैं, दैट नाउ एक्चुअली फिजिकल हेल्थ के साथ मेंटल हेल्थ इज ऑल्सो अ नीड टू टेक केयर। तो वहीं पे मेंटल वेलनेस इंश्योरेंस पॉलिसी हम लोगों को इलनेस को कवर करते हैं, उसी तरह मेंटली भी अगर हम हैप्पी रह पाए और उसके लिए भी एक इंश्योरेंस जैसा एक इनोवेटिव आइडिया भी माइंड्रो इज कमिंग अप। पंकज जी, वॉट एवर वी हैव टॉक, आपके हिसाब से कोई एक पॉजिटिव मैसेज टू गिव टू द व्यूअर्स?
Samrat, basically, I am not a philosopher or like that. I am just a businessman, and I always.
No, actually, you are doing something more than a business in this, because सिर्फ अगर बिजनेस की बात होती तो ये एक प्लेटफॉर्म जो किया है वो एक बिजनेस से कुछ बड़ी बात है सर।
राइट सर, थैंक यू। एक्चुअली मेरी सोच ये है कि भी कल को अपने ध्यान में रख के आज में जीना चाहिए, और जो चीज आपको अच्छी लगती है वो आप करो, whether it is music, whether it is swimming, whether it is reading, writing, whatever it is, आपको जो चीज में खुशी मिलती है ना उसको आपको करना चाहिए। आपके कितने भी बिजी शेड्यूल है उसके अंदर भी अगर आपको जो चीज आपको पता होता है, ईच एंड एवरी पर्सन नो वेरी वेल दैट मुझे कौन सी चीज अच्छी लगती है, मुझे कौन सी चीज ज्यादा खुशी देती है। मैं जैसे आप मुझे जानते हो काफी समय से, तो मैं हमेशा, मेरा कितना भी बिजी शेड्यूल है लेकिन आई लव म्यूजिक, तो मैं कुछ भी छोड़ के म्यूजिक के लिए मैं हमेशा हाजिर रहूंगा जी। जो चीज आपको अच्छी लगती है उसे करना चाहिए, ताकि आपका जो मेंटल वेलनेस का प्रॉब्लम है वो मेरे ख्याल से काफी कम हो जाएगा
जी। ग्रेट। पंकज जी की एक खासियत जो मुझे भी बहुत अच्छी लगती है, which I really need to share with the audience also and with other panelists also, he's a very good writer also. He doesn't write long blogs or something, लेकिन he writes one liner, two liners। एक बहुत अच्छा सा one liner जो मुझे बहुत यहाँ हार्ट तक पहुंचा। उन्होंने बहुत अच्छा लिखा था कि what is the definition of success? सक्सेस की डेफिनेशन क्या होती है? तो उन्होंने उसका जवाब ये लिखा कि सक्सेस की डेफिनेशन ये होती है कि अगर कोई आदमी आप पे ट्रस्ट करे, दैट इज अ सक्सेस। So the same philosophy goes along with all the panelists and all the profession which we are catering right now, because ट्रस्ट जब आता है तभी आपके साथ कोई बात करता है और तभी आपके साथ कोई खुलता है। इट इज अ वंडरफुल टू नो the nuances of all the different professions, but with the same kind of ideology and same kind of background. So I really would like to say thanks to all our panelists जिन्होंने ये टाइम निकाल के हमें माइंड्रो मंच के सभी श्रोताओं को ये बहुत ही एनलाइटन एक्सपीरियंस दिया, एंड वी आर रियली हैप्पी टू हैव यू always on the sides of Myndro, and looking forward to have you more in the near future. Thank you all.
Thank you so much.
Thank you.